Now, how do I know how much vitamin D I should take without having to do a blood test? For adults, the recommended daily amount is 400 to 800 units, and in darker skinned people, I would recommend 1000 to 2000 units, which is equivalent to 25 micrograms. Ideally, if you have symptoms, you should have a blood test for vitamin D, as it lets you know your levels, and this can be rechecked 3 months after taking vitamin D. Otherwise, you can take 2000 to 5000 units for 3 months, so a darker skinned person might want to take a higher dose than a white person. So if you had blood tests, these are the levels to look out for. If you're deficient, you would have less than 30 nanomoles per litre. Insufficient is 30 to 50 nanomoles per litre. Sufficient, 50 to 70 nanomoles per litre. And optimal levels where your vitamin D is over 75 nanomoles per litre would be common if you lived in Australia, or basically if you were in a sunny beach all day for the whole year. For levels of less than 30, you'd be given a high loading dose of vitamin D of about 300,000 units. Now this varies from region to region in the UK, but I would expect a standard regimen of 20,000 units for 3 days a week for at least 6 weeks, and then a maintenance dose of about 1000 to 2000 units for the rest of the year. Check blood tests at 3 months. This will tell you if your levels are still low, are they back to normal, or are you taking too much of vitamin D? At 30 to 50, I would expect to take 1000 to 2000 units for 3 months and check blood tests afterwards. At 50 to 75, all you need to do is increase your dietary intake and take a 400 to 1000 units. Over 75, like I said, means you're getting good exposure, so continue with whatever you're doing. However, if no blood test done, the safest approach is to assume that you're in the 30 to 50 group, which is the majority of the people in the UK. You should take vitamin D all year round and increase your vitamin D intake during the autumn to spring season, for example, October to March. If you're feeling tired, lack of energy, bone pain, muscle aches, headaches, poor sleep, then try and get your vitamin D tested because you could have low vitamin D. Now, if you like this video, please subscribe to my channel and check out my other videos.